So without further ado, let me come to our speaker for today, Dr. Sudipta Roy, who's the founder and director of Silence Center. She has completed MPhil in clinical psychology from the Premier Institute of Nimhans, Bangalore. She is an RCI licensed clinical psychologist, mental health trainer, and also psychology teacher. With more than 26 years of experience, she has conducted a course on mental health assessment in collaboration with Roehampton University, London, and MS University. And currently, she is engaged in internal research in collaboration with the University of Maryland, USA. We are so very pleased to have you here with us, Dr. Sudipta. Thank you so much for joining us today. Welcome to Abilities Workshop. Thank you so much for joining us today. And without taking much of your time, because I'm pretty sure the audience members are really eager to hear from you, I would request you to take up the session.
Thank you so much, Swati, for the nice introduction. And I'm very happy to be here among all of you on the World Health Day. And this is just to improve the health of our children a little bit, especially the mental health. That's why we are here. And I hope you will benefit from today's session on ADHD. Today, we are going to be talking, as Swati already mentioned, that we'll be talking particularly about the classroom interventions for ADHD, which I think is quite a challenge for a lot of teachers. So let's get into it without any further ado or delay. Should I begin screen share, Swati?
Yes, please.
Are you all able to see my screen now?
Yes, we're able to.
That's great. That's great. So we're talking about managing challenging behaviors of children with ADHD in a classroom setting. And we're going to be looking at some important strategies and techniques which we can use to help these children in the best way possible in such a, out of all the settings where our children go, the school is the most formal one. And we want our children with ADHD to be able to adjust into these formal settings better. And maybe if we extend a hand forward, we'll probably be able to help them a lot in this adjustment. So to start with, I'll ask you to imagine that you're making a garland with a thread and some flowers. And the flowers could be any color of your choice. You may choose yellow ones, you may choose white ones, you may choose red ones. And you make a garland of the flowers in your head. It looks very beautiful. You can use it to put it on any frame. You can put it on any other idol or anything. But what happens if I remove the thread? I think you got it right. It must be that the flowers will fall down and there won't be any garland and you can't use it to put it anywhere. So that is a characteristic of attention actually. Attention kind of threads all our activities together. Everything that we do in our lives is highly dependent on the ability to attend to that phenomenon. If we can't attend to something, the chances are that we will be missing out on learning, we will miss out on sensory experiences, and we will miss out on memorizing. So attention being a very key skill. Can you imagine what happens to a child with ADHD? The child with attention deficit lacks this very skill, which is holding everything together. And that makes them, a prime candidate for learning difficulties and behavioral problems and social maladjustments. Just a moment. I need to. So the overview of today's presentation is that we'll be covering ADHD and its characteristic features, which you probably know by now. We'll get an insight into the unique needs of children with ADHD. We will cover their challenging behaviors and some strategies and techniques. So ADHD is one of the most common neurodevelopmental disorders in childhood. Its prevalence ranges from something like 11% in Indian context, and the Western studies show something like 5 to 15%. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention. They face difficulty in controlling their impulses. They may act without thinking and they don't seem to care what the result might be. They would also be overly active. So the categories in which you can divide ADHD are three. One is inattentiveness, the second is hyperactive and impulsiveness, and the third is combined. What happens in these different categories of behavior? We'll look at that. The first one we said was inattentive type. It's called ADHD inattentive type. Here, the child is not able to give enough attention to their tasks. And because of this, they may give too little attention to details. So they make careless mistakes in schoolwork, homework, and in other activities. They cannot sustain their attention on any task, including play. It also means that they do not pay enough attention to things like screen activities and also maybe cartoons or watching movies. They can't do any of that to the end properly. They have difficulty in listening when spoken to directly. They have difficulty in following through on instructions. And due to this, they may often leave their work incomplete. So these are the children who might often come to you with incomplete school books. You give them a task and they don't seem to have finished it. They're drinking milk, but their glass remains only half drunk. Their food plate often has leftovers on it because they lose focus and they get sidetracked. Due to inattention, the child has trouble organizing different tasks and activities. They tend to avoid tasks that require mental effort over a long period of time, such as schoolwork or homework. They lose their things, maybe their pencils, erasers, sharpeners, books, tools. The older kids tend to lose their eyeglasses, mobile phones, keys. They also get distracted very easily and they may forget what they need to do in daily activities. The routine that happens every day, like you brush and bathe, they might forget on some days to do the common things also. Then there is the hyperactive impulsive type. This is the child who's the mover, fidgets a lot with the hands and feet, squirms in their seat. They leave their seat in various situations where they're actually expected to remain seated. Like say in an assembly in school, you're not expected to walk out when the principal is giving a lecture. But this child might. They may run about, climb inappropriately. They may have difficulty in taking part in any leisure time activities quietly, and they often act as if they're driven by a motor. They will also be talking excessively, and before you raise your question, they have an answer out. They have trouble in waiting for their turns, might interrupt and intrude on others. So parents often feel quite disturbed by the presence of such a child because the child will not let you do anything peacefully. So now when we're talking about ADHD, one thing that we need to keep in mind is that the symptoms should be present in at least 2 or more settings. Only then you can say it's an ADHD. So the child with ADHD should have similar symptoms at home or at school and equally in the playground or at friends' houses or while doing other activities also. So it's very important to note that it should be there in more than one setting. Secondly, it's important to realize that these symptoms will be reducing the quality of social interactions. It will reduce their school functioning as well as the work functioning in later years. It has become most common nowadays to encounter young adults who are facing tremendous difficulty in their life on account of undiagnosed ADHD in childhood. So let's look into some unique insights about the needs of children with ADHD. So students with ADHD are different, of course. Like we look at all the special needs children, we realize they each have their own set of abilities and their own set of needs, and they have a set of behaviors which can set them apart from other categories of special need. So these children tend to express themselves differently. It's important to acknowledge that. The second thing is that their impulse control is not like other students. They often, they are the ones who invite people to do things rather than wait to be called on. So in a group of students, if there's about 15 students in the playground, the one who is initiating the play activities is often likely to be somebody who has hyperactivity. The other thing that we also see in ADHD students is that they need to be treated in the same way as their peers, but they don't often get that reaction from adults. They need to be treated with respect, and if we show them respect, they will show us respect too. If we don't treat them as well as their peers, we will harm them in very long lasting ways, and it affects their self-esteem tremendously, which is why a lot of children with hyperactivity end up having low self-esteem also. It's important to understand that ADHD is a very important disorder that can be handled, and if we handle it well, it can be turned into a strength rather than a weakness. We need to connect to the children with ADHD. Often what happens is in a classroom, the teacher is so frustrated with the child with ADHD that they can only have negative feelings towards the child. If we are able to look beyond those negative feelings and develop a relationship and treat the child with positivity, then we will be able to help them in much better ways. So teachers might need to express their empathy. They may need to demonstrate awareness of the difficulties of these children. And also, they may need to build a deeper rapport with them, like calling them during recess, spending 5 minutes extra with them, assigning them little tasks, may go a long way in building a good relationship between the teacher and child. So looking more into the insights on what happens or the characteristics of ADHD. So these children basically have a window of a very short span of time. They are able to do their task and focus for just about 15 to 20 minutes. So what would we need to do as a class teacher for such a child? We would have to break down our tasks of the day into different sections, small doable bits which allow the student the opportunity for success. When we adapt the workload for a student with ADHD, we must remember that there is a window just of 15 to 20 minutes with us. If we can tap the child's abilities during this time, then we will find that the child is much more responsive to us and can actually retain information better. So you may have a long class of 35 minutes. You may have a lot of syllabus to cover. But if you can plan your work so that it targets this focus window of 15 to 20 minutes, then you have made a difference to the child with ADHD. It's also important to have a routine. Now, this must have come up in different special needs cases actually. So the ADHD child has to have a predictable routine wherein we allow the students to understand how the day is organized and that it is going to follow this pattern every day. And this routine helps them to develop a sense of organization which is actually missing in their brain characteristics. We say that children with ADHD have a weak frontal lobe. Their executive functions are disturbed. And maybe we can go so far as to say that there are some impairments in executive functioning in children with ADHD. Executive functioning is the boss of all activities of the brain and body. So if the boss is weak, you know what's happening. Not much is happening actually. So the sense of organization has to be developed through small tasks which are well organized for the child with ADHD. Now, when we teach a student with ADHD, we also have to have a classroom management system in place. prior to the students entering the classroom. That means that all your things have to be organized in different places, and those places are predetermined, which you would have shared with the children of the class. Like say your books have to be in a particular place, the chalk will be in some place, the school bags go into a certain place, tiffins and bottle go into a certain place. And if in some cases there is a pattern of children doing yoga or meditation before they start their classroom day, then there has to be a place to keep away the shoes, and so that they can do their activity properly. And so if you allow, supposing in your classroom management system you do not have a well systematized way of doing these things, your child with ADHD can very much add to the chaos. And that is what you don't want to do. So have your systems in place, and the better your systems are, the more cooperative your ADHD child will be. So students with ADHD, on the other hand, also need some variation. So what does this mean? On one hand, we are talking about having a good schedule for the child, a predictable schedule also, and a proper classroom management system. But we want to allow the child to have some variations. That means if all the children are expected to write their notes sitting down, if this child wants to get up after 5 or 10 minutes and write while standing up, that can be allowed too. Then if, for example, it is a rule in your classroom that the children should be seated for the entire classroom duration, for this child, we may allow that after 15 minutes, he or she can be allowed to take a round around the classroom and come back to their seat. So such minor variations may have to be made in your schedule and in your way of functioning in the classroom, which will help the child to do better. So there will be times when the student with ADHD are not present mentally in the classroom. It's very important at that time for the teacher to take a step back and revisit the lesson with these students at a later time. So I think teachers must be quite familiar with this, that you look at a child and they are not paying attention. They seem to be there in the class, but their mind is somewhere else. So for such children, tough though it sounds, it's a good idea to take some 5 minutes at the end to catch their attention and revisit the main points of what you've been doing. Maybe you need to call up the student at some other time and just let them know, okay, in today's lesson, these are the 10 points that were covered or the 5 points that were covered, and this is the homework you're supposed to do. Then you have to remember that force doesn't work too well with children with ADHD. So if you are trying to make it a power struggle, like you listen to me or else, then you will find that the student will resist and do less. And this will create a lot of frustration, both for the student and the teacher. What works better is to try and, elicit cooperation by being gentle yet firm, and also being respectful whenever we create a task for the child to do. And if they are being defiant, it's a sign that you leave them for a bit and then come back when they are more amenable to your instructions. So what are some of the challenging behaviors in children with ADHD and how can they be managed? Let's take a look at that. So because of the difficulties in ADHD, children with ADHD tend to be defiant often. They are often aggressive, and this reflects in their academic performance and their engagement in the classroom settings. So it is tough to manage a child who's defiant. What do we mean when we say that the child is defiant? So this child has a no to everything. They may be argumentative for everything that we are telling them to do. And aggressive behavior may include even calling out names or speaking rudely, or maybe hitting other children, or even sometimes in very rare cases, hitting the teacher has also happened in some schools. So these kind of behaviors need a specific format to be managed. And all of that starts with a good relationship between the teacher and the child. The other kind of problem that we might see in such children is that they may be receiving unfavorable reactions from school management, such as detention and expulsion. Like a child who I had seen in my clinic had a problem that he was rusticated from school for 10 days. Why? Because he accidentally locked two other children out of the school gate in a room. So there was a practice, it seems, in the school that children, when they are coming down from the staircase, they are asked to shut the door, and that responsibility goes on rotation. Now, this child was only 6 years old and had a severe ADHD, and that day it was his responsibility to shut the gate. So he didn't remember, but then as soon as he came out of the gate, the teacher said, "Oh, go back and shut the gate. You left it open. It's your turn today." So the child just went and did that. Now it seems that two girls got locked there, and after a lot of banging, they were discovered after 3 hours of the school being closed. And this was seen as an act of malice or a deliberate hostile act from this child, and he was rusticated for that. But the child had no clue about this whole act, and he didn't know what he had done wrong to elicit this punishment. So, but because the child with ADHD may act sometimes without thinking, they may not retain the instructions very well, they don't know the consequences of their behaviors that well. So they end up putting themselves in situations where unfavorable reactions from school management are generally got. Like, say, very often children with ADHD have turned up in my clinic because they have damaged some school property, which could be like, okay, throwing a ball, breaking a window, or else they've been told by somebody as a dare that, I bet you can't break the wash basin in the washroom. And they end up doing that on instigation from other students because they can't judge the consequence of their action that way. Now, another sad part is that children with ADHD often get bullied in the school, and at some times they also become bullies themselves. And now, needless to say, all these behaviors of ADHD can affect their caregivers, and parents may feel frustrated, anxious, exhausted because of these constant challenging behaviors. Number of parents of children with ADHD say that we never go to PTMs because we'll be told about all the things my child did wrong. Research shows a few things about children with ADHD, that challenging behaviors like non-compliance can impair their social relationships, especially with adult caregivers. And this can lead to feelings of demotivation and isolation in these children. You may have noticed, if you are observant, that children with ADHD often do not have friends. And you ask the parents or the teachers, they say that nobody wants to sit next to them because accidentally the child with the ADHD might hit them or might hurt them, or they move so much that it's difficult for the other child to pay attention. And then in a building where the child lives, other children in the building refuse to play with them because they're always, changing rules, not following the rules that everyone does. And before they might just butt in and want to have their turn first before other people. So all of this can be very disturbing in the social interactions of the child. And longitudinal research has also suggested that girls with ADHD are more at risk of self-harm and suicide as they grow older, which is very serious. I would say that today it's one of the most serious things that we are facing in a clinical setup, dealing with adult ADHD and the issues that have persisted into adulthood. You as a teacher or a special educator or a parent can make a huge difference in the child with ADHD's life by attending to these small needs right in the beginning and doing it consistently. And that would then bring about a lot of change in the child with ADHD. So let's now come to the strategies and techniques to deal with the challenging behaviors. So it would be better if we can focus on the functional impairments of ADHD rather than ADHD symptoms. Like we see that the ADHD symptom is that the child, might not be attentive in the classroom. So trying to increase the attention span directly by giving rewards behaviorally for better attention is less useful than working on the deficit of attention in a neuropsychological manner. Now, what does that mean? So you make the child engage in tasks which can extend their attention span, like say doing a pegboard, maybe even putting beads on a necklace. You can even engage them in coloring with certain rules, sorting activities. So all of these things feed into their brain muscles directly rather than just controlling the ADHD symptoms. Apart from this, children's behavior in the classroom can be very nicely managed by creating a reward system wherein you can encourage positive behavior and set up some positive reinforcements or reward for those behaviors. Like you want your child to be seated for at least 15 minutes in the class. So you give that instruction before you start your teaching. Tell them to keep the eyes on the clock and say that, okay, when it's reached 15 minutes and if you haven't got up from your seat, then I'm going to put a star against your name on this chart. And at the end of the week, the number of stars you got can be traded for something, some kind of a facility in the school. Like maybe we can ask if the child gets about 10 or 20 stars in the week, the parents may give some money to the child to buy something from the canteen once a week or something like that. So a positive reward system needs to be set up. Some of those positive rewards can be done directly by the teacher without involving parents. On the other hand, certain rewards might need the intervention of the parent. Rewards that can be given directly by the teacher are, verbal praise, making a star, praising them in class, and also maybe giving them little tokens that are permitted within the school setting, or trading it for some free time or some movement in the within the school premises or playground activities. Now, on the other hand, we can also reduce their negative behaviors by using negative reinforcement. So negative reinforcement does not mean hitting the child or trying to discipline them very harshly. What it means is taking away some rewards that were given to the child. Like say, for example, you've been giving stars to the child for good behaviors. If they do a negative behavior, we give them a black dot. And if they've got 5 black dots in the week, then it means that they are not going for PE class, or they are not going for the music class, or they will go 10 minutes late to recess on a particular day. Something like that would need to be set up. Other kinds of negative reinforcement might be, letting them sit in a corner of the classroom and reducing interaction for at least 10 minutes. Like nobody can talk to them for 10 minutes. Something like that can be set up. So these kind of teacher-led approaches can promote positive behaviors in the classroom and will also help the child to engage better in academic activities. Now, as a teacher, you would need to understand the child's strengths, weaknesses, and their other needs. This can be done through formal and informal assessments. So you can refer the child to a clinical psychologist or an educational psychologist or to the school counselor, who can do assessments and let you know what are their strong points or their weak points. You also would often need to work on the motor skills of the child, the attention level of the child, and the organizational skills. So motor skills often are very much linked with attention activities, and both of them are addressed by the same areas of the brain. So fun activities that include attention along with motor skills tend to work well. Like say, for example, one of the things that I did with preschool kids used to be taking a torch and shining a light on different points on the floor and making the child jump wherever they find the light. So that means that they are using their motor skills and they are paying attention. And this activity can go on for about 10 to 15 minutes. So, and it will be fun as
Dr.
well.
Sudipta, sorry to
Yes.
interrupt you. Few of our participants feel that they're not able to hear you very clearly. So may I request you to be a little louder while going? I am able to hear you, but maybe if you could attempt to be a little louder so that more of
Okay,
them could hear you clearly.
okay, so I'm also switching off my fan, so that might help you to hear better, and putting my face closer to the mouthpiece. So I hope this improves the audibility. Yeah.
Yeah. Thank you so much.
So now we also would need to create a well-organized class environment with some regular, consistent schedules and routines, and help the child to remain calm and positive, and help children in the classroom accept the child with ADHD. And if we are able to, in certain small instructions, if we are able to tell the child on how to organize their time, then they will be able to tap those brain areas which are weak and which will help them to actually defeat their ADHD more strongly. Now, sometimes it happens that family environment at home tends to aggravate the child's challenging behaviors. Like say, for example, sometimes the fit between one of the parents and the child, or both the parents and the child, leads to negative interactions between them. And this creates a scene where the child actually comes to school every day with some negative interactions already occurred in the morning, and this might increase their behavior problems in the school. Sometimes things that have happened in the school environment may aggravate the problems at the home environment. So we have to think about that when we are actually addressing the issues related to the ADHD child, rather than holding them responsible for every mistake that they make or each challenging behavior that they have. We should be more considerate towards them and try to examine all the facts available to us in the most supportive manner. We also need to give psychoeducation about ADHD to parents. In fact, I would go so far as to say that we need to psychoeducate the child also. We have to tell the child that there is something called ADHD and that your brain might be functioning in these ways, and we can make it simple to meet their age and their needs. And once a child understands that if they don't work on these things, these deficits might persist, then they might cooperate a lot more with you. But I know it is not an easy task. Many times parents don't respond well to psychoeducation. And sometimes children feel upset because they feel they are being labeled. But if we can do this non-judgmentally, in as positive a way as possible, we might make a much better mark. So psychoeducation helps parents to improve their behavior towards their child with ADHD, and as a result, the child's behavior in the classroom also improves. One of the things that we can create for a child with ADHD is to implement cooperative learning. Now, this can be done by assigning specific roles to every student in our classroom, especially if the class is small. If it's big, we might have a group of children who are assigned such roles, and each of them will design an activity that could help them learn a portion of their syllabus or the chapter that is going on in class. And so it's a kind of a peer-to-peer learning system wherein the teacher ropes in the help of different children who are going to design activities that will help them to learn a portion of their syllabus in a better way. And sometimes if we include the ADHD child in helping other children, or else involve other children in helping the child with ADHD, then they learn how to complement each other's skills, and they learn teamwork and cooperative learning. And through such a buddy system, we may be able to improve the social skills of the child with ADHD. A very effective way to help out children with ADHD is to use visual, audio, and environmental prompts. These aids can be put in places around the child, on their desk, on the walls, so that the child can look at it and get cues and then function in a better way. For a child with ADHD, we would have to give them frequent feedbacks, and so that they know that this behavior of mine is good, it's the right way to behave, and such behavior is not the right way to behave. That needs to be given to them. A team approach is very much necessary with children with ADHD. That team approach has to include key school functionaries, teachers, school counselors, parents, and the child for a successful management of ADHD. So collaboration of all the stakeholders in the educational system will increase the success rate, and you will have a child who's turning out to be a good citizen of where they are. Academic concessions is something that a lot of schools don't want to give at times, but now they are under a lot of pressure from governmental bodies that they have to provide some concessions to our children with ADHD or learning disabilities. So some of the things that children with ADHD are actually eligible to receive is that they can get extra time for assignments and exams. They should be given leniency in checking written work. In fact, we would say that the child should be given less of written work, which can be done in a better manner. So we kind of target more accuracy rather than large volumes of work in children with ADHD. We also need to allow them for frequent breaks and allow them to move around, but with a little bit of supervision. We also need to make arrangements for reminders and prompts, even during exams, for the children with ADHD. So what are some of the conclusions and key takeaways in managing children with ADHD in the classroom? That we should probably take not so much of a symptom control approach, but try to work with the inherent neuropsychological deficits of students with ADHD. And that would serve in a better way to manage their behavioral challenges too. Working with children with ADHD requires an understanding, and it also requires acceptance. Also, we need to move beyond labels. So we need to have the understanding of the label. We need to address it properly. We have to label, but at the same time, go beyond it, because even behind the ADHD is a very creative, a very active, energetic, and loving, and what do you say? Not just loving, but a person who needs love behind all that, behind that label. So many times, if we don't address these issues in the correct manner, we create a very wrong type of person to get out into the world. What happens with them is, if we don't treat our ADHD children right, they are the people who get liable to fall out of the school system. They are the people who get into wrong activities, and sometimes may have conduct disorders. They are very much at risk for conduct disorders and antisocial activities, just because of the labels that we give them and the incorrect feedback that we might be giving them as per their needs. So that's what I have to say for today. And these are my references. We can, yeah, I'm sure we'll be sharing other things a little bit further down the line. Thank you all so much for listening.
Thank you, Dr. Sudipta. That was a wonderful session, very insightful, definitely.
Okay, I'm glad to hear that. Yes. Yes. Should I shut off my video and you carry on with your?
Yeah. Thank you so much. So, dear participants, if you found today's session insightful and you could learn something from the session today, you could share, and you want others to benefit from it as well, you could share the link of the event takeaways page, which is being shared in the chat box by our team members right now. This link will give you access to the slide deck of today's event, and it will also have link to other resources, as well as the recording will be made available over this link itself in 2 to 3 working days. If you wish to share feedback about today's session, the feedback link is being shared in the chat box right now. Do not forget to tell us how we can improve this experience further for you all. And if you liked this experience, one way for you all to say thank you is by helping us to spread this awareness further. And like I have already mentioned during the beginning of the session, the ways you could help us to spread this awareness further is by sharing links to our certificate programs, by creating or sharing resources on the Ability platform, or by opting to become one of the inclusion champions. To do any one of it, you could visit ability.com, or if you have any questions or queries, you could write to us at support@ability.com. Thank you so much for being such an engaging listeners. But we'll get started shortly with the Q&A segment of today's event. But before that, I would like to inform you all that we have 2 upcoming events on 12th of April and 21st of April from the Ability team. On 12th of April, we'll be talking about developing math readiness skills in children with special needs with Mrs. Smita Tripathi. And on 21st of April, we'll be talking about how you can help parents understand why children face academic difficulties with Dr. Mari Grace. So if you want to register for any of these events, the link to these are being shared in the chat box. The events will be broadcasted via the Zoom platform and also on Facebook at 12:30 p.m. Nigeria time, 4:30 p.m. India time, and 7 p.m. Singapore and Philippines time. So do not miss your opportunity to register for these events and also to share the link with others. Dr. Sudipta, are you now ready to get started with the Q&A segment for today's session?
Yes, indeed. Yes, indeed. Yeah.
Okay, so the first one we have is from Shantanu, Sadaf, and many others have asked if medication is necessary or compulsory for children with ADHD, or if ADHD can be managed with therapy alone.
So you see that we do classify children with ADHD as mild, moderate, and severe. So now if a child has severe symptoms in inattention as well as hyperactivity or in the combined type, then it is most recommended that we should engage, use medicines along with the therapy. So if they are not at that severe level in all the corners of functioning, then we can avoid that. And the second criteria used to decide whether medicines are necessary for a child with ADHD is how many areas of functioning are affected by the ADHD. That means that is a child having educational problems, behavioral problems, and social problems along with the ADHD, then probably it's a good idea to have medicines also involved. Otherwise, it's not necessary and therapy itself can help.
Sure. So it depends upon child to child, and like you always say, it varies from child to child, and based on their condition, the necessary measures need to be taken. The next question that we have is from Kiran Gupta. She says children with ADHD tend to gradually develop an oppositional and defiant attitude, which enrages the entire school authority at times. So how can we manage such behavior?
Yeah. So at the first step, when we encounter oppositional and defiant behavior, we have to remember that we must remain gentle and respectful at all times, no matter how disrespectful the child gets. So the second thing is that your behavior towards a child has to be consistently positive and good. These two things are generally most useful in preventing oppositional and defiant behavior. The third way, like supposing the child gets into such kind of defiance frequently and is creating a nuisance in the school setup, then we would need to go into what is known to behavioral contracts. These are available on Google for free. You can actually download a worksheet of that kind. In the behavioral contract, we have a clear definition on what rules in the school the child will have to follow, and that the child agrees to do such and such behavior. And if he or she does not comply with these behaviors, what will happen to them? The entire thing is written like a legal document and signed by the child, the parents, and the teacher, and somebody from the management in the presence of a witness. So once we do that, then the child is generally more careful about their behavior and will stop engaging in these defiant behaviors.
Thanks a lot, Dr. Sudipta, for that valuable session out there. So go to Google and look out for that format if you want to. The next question that we have is from Nina. Nina is asking us, what is the best and immediate strategy to calm a child with ADHD who is throwing tantrums at the moment?
Okay, so at the point when the child is giving a tantrum, that is not the time when you can discipline them. So the important thing that you can use there is a gentle touch. Take them to a corner where they are away from the attention eye of everybody, and then address them in a calm voice, repeating the same words calmly. That okay, let's try to calm down and figure out what just happened there. So, or we'll say that, okay, I'm ready to listen to you once you are calm. Just let me know when you're ready to talk. And just keep saying that and touching them gently. And in the corner of the room, when the child should have the back towards the wall and not many people around. Then you will be able to control the tantrum in a fairly reasonable way without making too much of chaos. And sometimes the children who got into a pattern of extending their tantrums because of previous reinforcements, it might prolong for a long time. In such a case, you may have to create, empty the room, and then only one person sits there or two people sit there and wait till the child calms down and is able to talk to you. Maybe if it's in a classroom, you vacate the classroom, let all the other children go somewhere else. Somebody else manages them, you shut the door, wait till the child calms down, then they talk to you. If they do this in the corridor, then we need to take them to a small room like the infirmary or something where they are secluded. And again, only one or two adults who are able to be patient and calm will remain with the child till the child is in a position to talk and be reasonable.
Sure. Disciplining the child may not be the solution, but making them calm first could help better. Dr. Sudipta, you did talk about the classroom setting. The next question that we have is actually from a teacher and very much pertains to the classroom setting. Sibol is asking, if a child can't sit in class for more than 10 minutes, no matter how interesting the topic is, then in this case, how should the teacher handle the child? And also as a parent, how to explain to the teacher, if a parent can help the teacher with some strategies to deal with such children in a classroom setting.
Yes, so what we need to do is when we start off the class, we have to have a clear set of guidelines about what's going to happen in today's class. So you start with naming the child who has the ADHD and the rest of the class, and then you say that, okay, in today's class, we are going to be doing X, Y, Z, and this is going to take so much of time. The first section may be 10 minutes, and the second section might be 2 minutes or 5 minutes, and like that. You'll have to break up in terms of time as well as content and share that with the class before you start off. then your child with ADHD should be seated in a place which is not away from the door and the windows, and there shouldn't be too much of stimulating decoration around them. Now, our tendency, and by the guidelines of the school, we are often required to decorate our classrooms brightly and in a nice colored fashion. But from the point of view of the ADHD child, that is not a very good thing. So we can employ something like a screen, a movable screen, which is, which is partitioned between the child and the other classmates for the time when they are not able to concentrate. Now, parents have an adverse reaction to something like that. They feel that the child is being treated badly, and the child, but then this is something that a child who has a very severe attention deficit may need to do. Okay, so what I'm talking to you about is that the first thing that you will do is structure your classroom session. You will repeat that order in which the things will be going on. And then you will tell the child that today you're going to sit for at least 10 to 15 minutes before you start moving out. And after 15 minutes, you must tell the child that when your 15 minutes are over, I will request you to get up and do this. Like, maybe 100 jumping jacks, or taking a round in the floor that the classroom is, or taking 5 rounds there and coming back. So you have to give them scheduled breaks with physical activity. Only then they will be able to respond well to your class. Yes.
Very, very well said, Dr. Sudipta. I think so. Planning for some accommodations, which you must have informed to the audience members today within the school setting, and then planning the sessions better, which could be divided into short durations of time, could possibly help children with ADHD. The next one that we have is from Joyce. Joyce is asking us, like you did talk about parents not being very open to the fact that the child was made to sit in a different part of the classroom. How to help parents understand that? And Joyce has a further addition to that question, where he asks, how can we help parents who are in complete denial of a child showing signs or symptoms of ADHD?
Yeah, isn't that very common? I think we're all really struggling with those issues. Well, I think that parents have, they have every right to be in denial because they weren't born with the knowledge of ADHD. And many of us grow up seeing children, of different levels of activity. And I've met a lot of parents who tend to mistake a normal active child for hyperactivity, and also the vice versa. Like a hyperactive child is just labeled as being, oh, my child is just active. So they don't understand the difference between activity and hyperactivity. So our first job for parents in denial is to take 3 to 4 sessions of psychoeducation in the most empathetic manner. So we need to understand that the parents are not our enemy. It's not that they are wrong because they don't understand what we want to say, but it means that we have to try harder to make a breakthrough with the parents so that they understand what we are trying to say. So if you have an empathetic attitude and use some nice, you can use some nice books to enhance their understanding of ADHD. Now, NIMHANS has come up with some very nice colored graphic books to create awareness about ADHD that can be used as a, as a media for dialogue with the child. And there's another book which can be used as a media for dialogue with the parent. So you can use both these materials. They are freely available on the website of NIMHANS. And you can use that and then take a very slow approach. Go through this psychoeducation 3 to 4 times in bits and parts. Once you're able to show evidence that this is what is happening to the child, excuse me, yeah, then the parent will not deny, because even they care about their child. When they see the impact of the ADHD on the life of the child and in the classroom of the child, then they will be able to respond to it properly. Yes.
Sure, sure. Well, you did talk a lot about psychoeducation, and I think so that is really important while having the conversation with parents. With regards to that, we have another question from Tina Khatri. Tina is asking if the teacher is psychoeducating the child about ADHD, and the child asks if or not they can tell their friends and peers that they have ADHD. If this is the question, then what should be the answer and how it should be tackled? Should the teacher allow the child to tell their friends and peers that they have ADHD?
I think that is a double-edged one, you know. As such, I would like children to get the understanding of their condition, but we have to warn them because children with ADHD tend to kind of, you know, be very disinhibited with information. And sometimes that information doesn't work in their favor. So we have to guide them that I would suggest that you do not talk about this to your friends and others. Until they are in a position to understand this better. And I think maybe the teacher is in a better position to talk to other children about what is ADHD without really labeling the child. Okay, so I've come across children who really feel very upset when they are told that they have something like ADHD, and so they feel that it is like, you know, they've been given a bad word or a bad label, and it upsets them for days and weeks. And other children, when we give them the label, they start using the label as a crutch. So they say, okay, I have ADHD, so I can't do this, I can't help but be bad to you, or I can't help but hit you. I didn't do it intentionally, it's my ADHD, kind of a thing. So, but a lot depends on how we do the psychoeducation. So if you are telling the child that you know, ADHD is a condition wherein the brain functions in this way and it can make you do XYZ things. So it's now your responsibility with my help to take care that these things don't happen, so that you are, you know, in a better place, and that people can relate to you better, and you'll be able to do the things in your day in a much more smooth manner. So we will caution the child about using the label, and we will tell them that, you know, our job is to beat these functions of the brain. So, and then it will be the teacher's responsibility to psychoeducate other people who need to know that this child has a condition for which they need a more sympathetic management. So, yeah.
What a wonderful way. Maybe make the child aware about the condition rather than giving the label directly. So hope that helps to our educators and teachers who are listening us. Another question, you did talk about the emotional impact of being labeled. So in that regard, we have a question from Shifa. Shifa is asking us, what can be done for managing the emotional regulation better? Sometimes the kid may get upset and guilty for very slight reasons, and once the child is upset, the child is emotionally uncontrollable. So is there something that can be done?
Yeah, so you know, we'll have to like, again, this comes down a little bit in the session 2 psychoeducation. So one of the things that we do with the child with ADHD is to inform them that part of the ADHD also goes into a brain area of the brain which makes you feel emotions very intensely. So when a small thing happens, you find yourself feeling more disturbed. So now what you do with these disturbed feelings, and when you're feeling so upset, so we'll tell them that, you know, on a scale of 0 to 100, you just rate yourself. Like, you know, what's the feeling? First name the feeling, then you say rate yourself on that feeling. And then we say, okay, take a few deep breaths. So you can give different games, like there are active mindfulness exercises, which one can do on a worksheet, or there are small breathing techniques that one can do. And once they do those techniques, then we tell them that, okay, now rate yourself on that feeling again. And then we say, show them that this is how your intense emotions can be regulated. And this is something that you can use anywhere when you find yourself feeling more upset or feeling something very acutely. So that is one thing. The second thing we would also want them to do is to find out triggering factors and their common ways of responding to them. in terms of behavior, activity, and emotion. So once we help them to write that on a sheet, that this was my triggering factor, this is what I felt, this is what happened in my body in terms of physical sensations, this is what I was doing when I felt upset. So this makes them much more aware and in control of their own responses. And then we help them to choose a better response in that situation. So then it generally helps to regulate the emotions. Yeah.
Helping them to choose a better response might really
Yes.
help, along with all the other things that you said. So since we're running short of time, I would be taking two last questions for today. So the second last one is from Veronica, where she is asking that children with ADHD or with inattention type issues are often reluctant to do the writing work or capturing the notes in class. And as a result, most of the times their note tends to be empty. So is there a particular solution to this challenge?
Yeah. So, yes, writing and ADHD just don't go together, and they are most children with ADHD have tremendous problem with writing tasks. So, what I would suggest is that we can follow. I mean, we first need to understand what is the issue. The child doesn't want to write. That might be one, which is the most common. If they don't want to write, then we have to make writing a more appealing task for them. So in that, how do we do that? Like one of the things I do is to engage them in a game. That how many times can you write your name in 2 minutes? And then I say, okay, how many times can you write your name in 5 minutes? And the same thing I would also do. And then, of course, we'll do it a little less than the child so that they get a sense of being competitive. And then we can give them a feedback that, okay, you seem to write very fast. And how did you like doing that? So they'll say that, okay, I like doing it for 2 and 5 minutes, but I don't think I want to do that again for a long time. So I say, how would it be if your schoolwork could be divided into very small parts where you don't have to write more than 5 minutes? Then we start working on that. So, and then gradually scale it up, like, 5 minutes can go to 10 minutes or 20 minutes. And then we will also instruct the teachers not to be very hard and fast about written submissions from the child. So, because a lot of intelligent kids with ADHD are able to write when required, but they don't want to do tedious writing, of filling out the answer books and the classroom notes and things like that. But there are some children who are not able to attempt the paper because of their poor writing skills. In those cases, you would need scribes and maybe prompters to help them to get back on track, read the paper again. This is where you were. Now, why don't you start writing again from here? So you need that. And for some children, accuracy in writing becomes an issue. So for that, you need very strong handwriting improvement program for them. So that can be done by somebody who's very firm and is perhaps a little strict in demanding a certain quality of writing that should be delivered in a short span of time. So we might give children a task like, you have to write 1 page of your notebook every day, and it has to follow these rules that you cannot go down from the line. It has to be done in these many minutes, and the handwriting should be neat and legible. So you give them those rules, but you restrict it to 1 page, sort of a thing. So those kind of tasks would help them to enhance their writing skills. And also making, you can even point out to them about how writing is a way of communication. So we do that through different games and exercises where, like, say that, let's pretend that you can't hear and you can't, you're not allowed to speak. Now, how would you communicate the menu of this restaurant to this person, like that? So, so you can engage them in little games so then they understand that, writing is a way of communication in absence of other ways that way.
Sure. You gave a series of interventions, many ideas to all the educators out there. I think so. Breaking down tasks into smaller parts does always help children with ADHD, which I've been listening during your conversation and also amidst different answers, giving them a challenge or trying out, different techniques like writing as a means of communication could be helpful. Okay, so the next and the last question for today's session is from Hansel. Post-COVID, we are living in the online era of education. And so Hansel's question is, how can we help children with ADHD, particularly if the sessions or the classes are being conducted online, if you had any set of advices?
Yeah, so I must say that this has been a Herculean challenge for children with ADHD. Attending online classes has been very useless for most children, and particularly useless for children with ADHD. I hate saying that, but yes, it is there. So what I think is that we really have to use the online resource very actively in order to make our classrooms much more interactive, and using the right resources to engage the attention of a child properly during our classroom. And if online classes are here to stay, then we would have to ourselves break our syllabus rather than going into volumes of information. We want to create a society where lesser parts of information can be worked on more deeply, and we can engage the interest and motivation of a child much more deeply while taking the class. So I think people like Ability will come up with nice, good resources which can be used interactively during classrooms with children with ADHD, and that would then make a lot of difference to the online class. The current way in which we are going, just lecturing and or maybe even using a whiteboard for writing during the class, would not be very successful for the child with ADHD.
We need to adapt for newer methods and maybe newer resources, and hope the 80,000 plus the community of Ability members help each other to find those resources, of course, under the guidance of experts like you, Dr. Sudipta. Thank you so much for such an informative, engaging, and enriching session. I am very sure that all the attendees today must have benefited from the valuable knowledge that you have shared out of your years of experience. Thank you. I would like to remind the attendees that if they wish to share the feedback for today's session, the link is being shared in the chat box. Please do share your feedback and help us improve the experience further for you. If you wish to register for the upcoming sessions from Ability, which are scheduled on 12th of April and 21st of April, the links are again being shared in the chat box for you to register from. So, Dr. Sudipta, how was your experience for today's session?
Well, it's been lovely. The questions are so nice. I'm looking at them. There's a lot that we couldn't answer and take up. I certainly hope that we'll be able to do it in some other ways also. Sure. If you like, I might even send you some responses on email to some of the questions if you share that. Sure. It's been lovely. I think I really love the approach that Ability has taken, and I'm so happy to hear that there are 80,000 people in your community, and these free webinars are incredibly useful across all cadres of people. Thank you so much. I loved being here.
Thank you, Dr. Sudipta. Hope Ability community continues to make a dent in helping children with special needs better through these free sessions and otherwise as well. And like you said, we will definitely try and endeavor to answer and cater to more and more questions that we receive during the session. Thank you so much, dear audience members, for being an amazing and very engaged audience. That will bring us to end of today's session. Thank you so much for joining us. A goodbye from Team Ability.
Thank you. Goodbye.